Hello everyone, today we are going to start the class related with INICET recall questions and answer sessions. Okay. So, first of all we will talk about what are the topics which were asked in INICET. Okay. The most important topic, that is maternal child head, it has been asked. Okay. Next is contraception, okay, immunization and cold chain, national programs, mukt bharat, and NBCP, that is National Blindness Control Program. Okay. Rabies, in the infectious disease there is rabies prophylaxis, which has been asked earlier in the exam also. Malaria treatment, entomology, viral structures. Viral structure actually is a part of a microbiology, but here it is asked in the correlation with the community medicine. Okay. Measure of dispersion, statistics, level of prevention, which is the most important topic asked in every PGME question. Okay. PGME examination, and epidemiology, the risk ratio, attributable risk, population attributable risk, theory of causation, as well as RCT. These are the topics which has been asked in the recent INICET. So, let us coming out of our first question. On the basis of recall, this question is made. Okay, so it might be there is some changes in the options, but the topic is same and the concept is same, so that if you are able to grab the concept, you will able to know all the things. Okay. So, the population attributable risk calculated between smoking and lung cancer is 95%. Okay. What does it mean? Okay. So, there is a population attributable risk, the main catch is population attributable risk, okay, and the lung cancer is 95%. Okay. So, as you know the formula of the population attributable risk, there is incidence in population, incidence among non-exposed upon incidence in total population. Okay. Here incidence in total population is taken, in attributable is in exposed is taken. Okay. So, you can see here incidence total exposed minus incidence in non-exposed. It is not our option. Incidence total population minus incidence in non-exposed. It is not a population because here denominator is not there. If smoking is eliminated as a risk factor, there will be 95% reduction in the annual incidence of lung cancer among the population. So, that should be the language. I have told you in our class that language is important in the terms of risk ratios. Okay. So, if smoking is eliminated, means smoking को अगर हम हटा देते हैं, so there will be a 95% reduction in the total cases in the population. For example, if there are 100 cases and smoking is removed, so only 5 cases will be there. Okay. So, 95% is among the population cases is attributable by the smoking. So, that should be the answer. Okay. Here it is among exposed, same language is there, but here it is among exposed. So, it is not population attributable, it is only attributable. Okay. Now, coming on our next question, that is related with topic RCT, randomized control trial. Okay. So, as you know that preclinical trials are there, preclinical trials are animal models for pharmacokinetics and pharmacodynamics can be obtained by these studies. Okay. The phase 1 trial in animal models, preclinical is in animal model, phase 1 trial is same thing in the human model. Okay. It is involved 20 to 80 healthy volunteers. Drug metabolism, that is pharmacokinetics and excretion, okay, obtained from phase 1 studies. Okay. phase 2 स्टडीज से क्या मिलता है हमको? phase 2 स्टडीज से हम लोग को मिलता है सेफ्टी का डाटा. ठीक है. सेफ्टी कंटिन्यूटी हम लोग देखते हैं, साथ साथ में क्या देखते हैं कि वो एडवर्स इफेक्ट, ओके, शॉर्ट टर्म वाले. ठीक है. और वेदर इज द ड्रग इज वर्किंग इन पेशेंट्स. These three things are taken in the phase 2 trial. phase 3 trial में हम देखेंगे 100 or thousands of patients are there and a comparison of drug is there. Okay, it is the original RCT. Okay, जो हम लोग comparison of drug देखते हैं वो इसी phase में ही करते हैं. ठीक है. Then we take FDA approval. Then phase 4 marketing is there after approved medication. Post marketing surveillance is called post marketing surveillance. Okay. So now coming on the options, phase 1 is pharmacokinetics, it is right in the humans, pharmacokinetics. Phase 2 is safety profile, it is also right. Phase 3 is 5 to 20 patient, it is wrong, no? It is 100 to 1000 patients are there, okay, in the comparison of drugs, okay. And phase 4 is post market surveillance, it is also right, okay. So we have to find the incorrect statement here, okay. So incorrect is phase 3, okay. Now coming on another topic, that is entomology. This is, what is this? This is a larva, okay. This is a larva. Option would be Anopheles, Culex, Aedes or Mansonites, okay. So as we all know, these are the eyes, this is the body, this is the head, this is the tail, and this is the siphon tube. Anopheles doesn't contain any siphon tubes. Culex and Aedes both contain siphon tubes, and siphon tubes are bented in the Culex and straight in the Aedes. Just see this diagram, photo. Aedes, okay. This is straight Anopheles, no siphon tube is there. Here is siphon tube, there is no siphon tubes. Here is siphon tubes tilted outside the water, okay, on the surface outside the water. So this siphon tube is there. This is our diagram, that is Culex, okay. Now coming on the next question, that is most common cause of moderate to severe visual impairment in India according to National Blindness Visual Impairment Survey. So the question is asked related with National Blindness and Visual Impairment Survey. So what the survey is, I have collected the some survey material. So you can see that for the age 0 to 49 years and age 0 to 50 years, 52 more years, okay, greater than 50 years, okay. So as per the definition of the blindness, less than 3/16 the better eye with available correction, and severe visual impairment is less than 660 to 360, moderate is 618 to 660, and early visual is 618 to 612 to 618. And in the question it is also moderate to severe. So moderate to severe is, this is moderate, this is severe. So that 6/60 to 3/60, 3/60 to 6/60 or less than 360, means these three. These three is maximum in which disease? Refractive error, cataract, glaucoma. Another option, it is refractive error, it is same, but actually I didn't get the fourth option there anywhere, okay. By the recall of some material I am searching, and some students have been telling me about the options, but I didn't get the fourth option, okay. So from the above three options I got the right option, that is the cataract. Why is cataract? Because you can see here refractive errors are common in the age group, early age group, but cataracts are also in the case of severe to moderate severe impairment. You can see that high prevalence is there, okay, moderately severe, okay, in the cataract, okay, if cataract is untreated. And most of the cases are for non-trachomatous corneal opacity, not the refractive errors, okay. Whereas in the old age, more than 50 years, you can see that 66.2 blindness, okay, and the severe visual impairment 80%, 70%. So in both the groups, cataract has a in the second group cataract has major contributor, and in the first group cataract is a moderate contributor. So overall we can say that cataract is the most common cause of moderate to severe visual impairment or blindness in the National Blindness Visual Impairment Survey, okay. Got the point? Which virus causes antigenic shift? As you can see that there are two kind of thing, drift and shift, okay. As the name suggests, drift is somewhat bending to drifting to here, drifting here, drifting here, but shift is for jumping from here to here. Okay. So, big mutations are there here, and for example, H1N1 changes to H1N2 or H1N5. Okay. These neuraminidase, this hexosamine, and the neuraminidase, these antigens, these proteins are changed, these enzymes are changed. Okay, in the kinds of shift. In the drift, the minor mutations are there, only there may be some epidemic situation may be there, but here pandemic can arise. Okay. And most common this is seen in the case of influenza virus. So, this diagram is there. So, which virus condition shift? That is the influenza virus. This is the Ebola virus. This is the polio virus. This is the bacteriophage. Okay. Now, coming on the take it, complicate of artesunate. Artesunate, we all know the artesunate used in the treatment of malaria. Okay. There are many species of malaria, Vivax, ovale, falciparum. Okay. These Plasmodium species causes malaria with the help of mosquito. Okay. In the cases of Vivax, chloroquine and primaquine is preferred, primaquine for 14 days. In the falciparum, most of the countries artesunate plus sulfamethoxazole pyrimethamine combination act SP. In the northeast state, lumefantrine is preferred. Okay. Okay. In the mixed infection, both act is given as well as permaquine for 14 days. This permaquine 14 days is given for axoerythrocytic cycle, which is not there in falciparum. So, in the falciparum, permaquine is in only 1 day. Okay. So, coming on the next topic, that is identify the wrongly matched Edward Jenner, chickenpox, James Lind scurvy, water reed yellow fever, streptomycin waxman. James Lind, we all know that scurvy, example of a citrus fruits, story is there in the epidemiology book. Walter Reed yellow fever, streptomycin discovered a waxman salesman. Okay. And Edward Jenner is related with smallpox, not a chickenpox. Okay. So, that will be the answer. The chickenpox is there. Okay. Hooch, Hooch is जहरीली शराब. हम लोग अखबार में देखते हैं ना, न्यूज़पेपर में आता है. Hooch is actually a toxic liquor due to the contamination or intentional use of methanol in the liquor. Okay, this methanol is very toxic. It can cause blindness initially, and the high doses cause serious depression and cause death. Okay. So, here methanol poisoning is the answer. The most common state where Hooch is there is MP. Okay, Madhya Pradesh. More than 50% of the cases of Hooch is there in MP. Okay. Dog by this bleeding site from the identify the correct statement. So, there is a bleeding from the site. So, category, what will the category? Category 3. It is a category 3 wound. In category 1, there is only licks on unbroken skin. In category 2, there are minor scratches without bleeding, and if there is bleeding, there is category 3. If there is category 1, there is no vaccine is required. In the category 2, vaccine is required, and in the category 3, vaccine plus immunoglobulin both are required. Okay. So, first of all, in all the cases, you have to clean with soap and water. This is soap and water. You have to wash that. So, this is right. Vaccine 0 through 7, 14, 28. This is the SN regimen. 5 regimen 1, 2, 3, 4, 5. 5 doses is the SN regimen, and 4 dose regimen is Thai regimen. Okay. Thai regimen is 2 side, 2 side, 2 side, 2 side. 2 doses in 4 visits, and it is an intradermal injection. It is intramuscular injection in SN. Okay. Dose may be 0.5 or 1 depending upon the which kind of vaccine you are using, which concentration of vaccine is following. Rabipur is 1 ml and another Virorab is 0.5 ml. Okay. So, in the Thai regimen, there is 0.1 ml of both vaccine in 2 sites. So, total 0.2 ml is given in that one visit. So, 0.2, 0.2, 0.2, 0.2, total 0.8 ml is used, and patient is vaccinated. So thyroid regimen is preferred in like countries like India because less vaccine is required, but intradermal required an expert handler. So where there is no expert handler, intramuscular doses can be given. Okay. So these both answers are right. Next is 2 doses of equine immunoglobulin. Okay. So equine immunoglobulin and human immunoglobulin both are can be given. Now if human is preferred, and this dose is 20 international unit per kg. Okay, but there is no 2 doses, it is 1 dose only. Okay, and don't suture the wound. Option should be the don't suture the wound. Don't suture the wound means if a dog bite is there, you don't have to suture the wound. Okay, you have to open the wound. Okay, open wound को ही हम उसको ओपन ड्रेसिंग करते हैं, उसकी क्लोज ड्रेसिंग नहीं करते हैं सुच वोंड की. ठीक है. दूसरा ये कि ये जो हमारी 2 डोजेज है इसकी जगह पे 1 डोज होता है. सो if in the option it is don't suture the wound, then that is right, this is right, this is right, and it is if it is 2 doses of equine, so it is wrong. So we have to identify the incorrect statement. So incorrect statement is option C. Now these all questions are based on the recall. Okay, so the crux is you don't have to focus on the question, but you have to focus on the topic. Okay, which topic has been asked. Okay. Another thing is that sometimes they may be asked the re-exposure. Okay, re-exposure. Okay, if again dog bite is there less than 3 months, then no thing is can be required. Less than 3 months में दोबारा वैक्सीन नहीं लगानी, and more than 3 months में only 2 doses 0-3 days पे. ठीक है, that's all. This is the thyroid regimen. Now another question was there. Identify this kind of diagram was there. Some circle was there and some lines were there like that. Okay, looking like a pie chart. Okay, looking like a pie chart, and option was there pie chart, and most of the people take upon pie chart, but this is not the pie chart. Okay, it is called as Rothman pie. It is like a pie chart, but it is a Rothman pie. Rothman pie is actually a sufficient component cause model. Okay, what is sufficient component cause model? It is related with theory of causation. We all have studied in the park about the Hill's criteria. Okay, Hill's criteria of the causation theory. Okay, but here there is another theory, the sufficient component cause model. Here there may be a cause which is necessary cause and the component cause. For example, tuberculosis. Tuberculosis necessary cause is Mycobacterium tuberculosis, but everyone who has Mycobacterium tuberculosis mustn't be tubercular. Okay, so there may be some extra component can be required, and environmental factors should be there, low immunity should be there. Okay, and nutritional status low hoga. So these all factors contribute to the development of tuberculosis. Another thing is sometimes HIV. If HIV virus enter in the body, so there is a sufficient, it is sufficient enough. If HIV enters in the body, it is sufficient enough to cause the AIDS. So sufficient cause is HIV virus. Here Mycobacterium bacterium alone is not sufficient, it is necessary, but along with the component causes it is sufficient. So this is the sufficient cause theory. If any cause is sufficient to cause the disease, that is the called the sufficient cause. Okay, so sufficient cause is made up of necessary cause or component cause, or sufficient cause can be individual as well. Okay, like HIV. As per anemia mukt bharat, what is the treatment of? So here the question was ABCDE. This A is a sufficient cause, so it is a sufficient component cause model. Okay. Another option were PERT. PERT is management, health management में आता है ना, program evaluation, review technique. Okay, I have told you about this in the class. Okay, As per anemia with Bharat, what is the treatment of 34-week anemic primi? Primi is there, anemia, 34-week and mild to moderate anemia. If there is severe anemia less than 7 hemoglobin, only blood transfusion is required, nothing is can be done. Okay, less than 7 ग्राम में blood transfusion करना और कुछ नहीं करना है. Okay, so there are two options, oral or IV. Okay, which is preferred? More often oral regimen is preferred in the mild to moderate cases. In the severe cases, the last moment blood transfusion is there. Okay, in the mild to moderate anemia, if there is enough time, you have enough time, you can prefer oral regimen. But if not tolerating the oral regimen, you have to inject ferric carboxymaltose. Okay. So in the treatment part, oral iron 2 tablets can be given. In prophylaxis, only 1 tablet is given. In treatment, 2 tablets can be given. Okay, and these 2 tablets can be given, and in 1 month 1 gram % hemoglobin should be increased by the 2 tablets. Okay, if it's not responding or the compliance is not good, so you can switch over to injectables. Okay, so this is the best option here. What are the non-contraceptive benefit of OCP? Okay, there OCPs has very big spectrum of benefits. Okay, some side effects are also there, some contraindications also there. This all has been asked in the regarding OCP, so you have to know about the OCP very well. Okay, so reduce risk of endometrial carcinoma. OCP reduce CEO. CEO means colorectal, endometrial and ovarian carcinomas. Okay, as well as ectopic pregnancies. Okay, these all are prevented by the OCPs. Okay, this STD is prevented by only by the barrier methods. Okay, this is prevented by the barrier method like condoms. Okay, so here answer should be the STD. Okay, sexually transmitted disease by the barrier method, not by the OCP. Okay, these are some non-contraceptive benefits of the OCP. Okay, menstrual flow decrease, hemoglobin increase, dysmenorrhea, bone mineral density increases, so there is less chances of osteoporosis. Okay, ovarian carcinoma decreases, endometrial hyperplasia decreases, endometriosis and recurrence is also decreased, colorectal carcinoma decreases, severity of PMS प्रीमेंस्ट्रुअल सिंड्रोम जो होता है उसमें भी जो सीवियरिटी बहुत ज़्यादा हो जाती है उसको बोलते हैं PMDD, प्रीमेंस्ट्रुअल डिस्फोरिक डिसऑर्डर. ओके, asthma exacerbations, here these all are reduced. Okay, for VVM incorrect statement is, for VVM we all know that this circle should be light or white. Okay, this square should be light or white, this one. Okay, this is light here, this is white here, this is light here, they can be used. If there is equal, no use. If it is darker, there is no use. Here you can see in the option, use the value if inner square is lighter than the outer circle, yes you can use. Use the value if inner square is changed but still lighter, yes you can use. Use the value it is same with the outer circle is same, it is not used. So the incorrect statement is this. Discard is the darker, yes discard. Okay, so the right option here is C, incorrect statement you have to find. Okay, in the question like correct or incorrect, you have to find out the incorrect. Now you have to focus on that. Sometimes you have find the correct options and you tick that. Okay, but these types of questions should be read twice, incorrect or correct. Okay, you have to check twice. Okay, minimum number of ANC visits as per WHO. Okay, for the minimum number of ANC visit, most of people shows that it is 4, but here is a catch here, it is asked about the WHO. Okay, so WHO recommendations are different from that. Okay, this 4 is for Government of India. For Government of India say minimum number of ANC visits should be 4. Okay, but WHO say it is 8. I have taken the document. A minimum of 8 contacts are required to reduce perinatal mortality and improve women's experiences are care. Okay, so this is a WHO document. Here 8 is given. Okay, so our answer should be 8. Okay, counseling about healthy eating and keeping physically fit, and iron folic acid is also there. Here folic acid 400 microgram, in our program 500 microgram is given in national programs. Here it is 0.4 mg or 500 400 microgram. Okay, 30 to 60 milligram iron should be given. Okay, elemental iron will be given. TT vaccine is same here. Okay, and ultrasound is also recommended here in 24 weeks. Okay, before 24 weeks ultrasound is also recommended. Okay, this formula is which is for the form for standard deviation. Okay, this is summation of all the different is individual values. This is mean, this is sample. Okay, if sample size is less than 30, so here it should be n minus 1. If sample size is more than 30, here it should be n. Okay, this is also asked earlier. Okay, so स्टैंडर्ड डेविएशन में हमें समेशन करना होता है इसका और उसके बाद इसका अंडर रूट करना होता है. ठीक है, स्क्वायर करके अंडर रूट करना होता है. ठीक है, सो फॉर द एच डी दिस फॉर्मूला इज यूज्ड. ओके, वी ऑल नोट दैट व्हाट इज मीन, सम ऑफ ऑल वैल्यूज अपॉन सैंपल, है ना. एंड मीडियन में क्या करते थे, मिड पॉपुलेशन लेते थे. तो यार ऑप्शन हमारे इसमें क्वेश्चन में क्या कहते हैं, मीन, मीडियन, स्टैंडर्ड डेविएशन, दीज वर द ऑप्शंस. ओके, सो स्टैंडर्ड डेविएशन शुड बी द आंसर बिकॉज दिस इज द फॉर्मूला ऑफ द स्टैंडर्ड डेविएशन. Image shows which level of prevention. Here you can see that it is a washing, so most people will think that is kind of primary prevention, but no, this is a kind of a complication. It is filariasis, elephantiasis, and this is cleaning of the legs by the soap water, not hot water. Hot water is not used. Okay, remember, hot water is not used in the cleaning of elephantiasis leg. Okay, normal soap water is used for cleaning so that no bacterial infection should be there, and if there is bacterial infection, the infection will be spread and ultimately amputation can should be required. So to save the limb we have to clean the legs, so any complication is limited. So level of prevention में अगर हम देखते हैं तो ये किस तरह का लिमिटेशन हुआ, डिसेबिलिटी लिमिटेशन हुआ ना. हम डिसेबिलिटी को लिमिट कर रहे हैं, ज़्यादा बुरा नहीं कर रहे हैं, उसके पैर को सही रख रहे हैं, जितना खराब हो चुका है. ठीक है, so there is a disability limitation here, so that disability limitation is called tertiary prevention, or rehabilitation is also a kind of a tertiary prevention. In the primordial prevention अर्ली एज में करते हैं, बच्चों में करते हैं, है ना. अच्छी आदतों को डालते हैं, हेल्थ प्रमोशन करते हैं, उसमें हेल्थ एजुकेशन करते हैं. इन द प्राइमरी हेल्थ एजुकेशन, हेल्थ प्रमोशन एज वेल एज स्पेसिफिक प्रोटेक्शन like immunization, chemoprophylaxis, these all are in the primary prevention. In the secondary prevention, the early diagnosis and treatment. So in the early diagnosis and treatment, what you will do, screening. Okay, screening can be done for early diagnosis and treatment. Okay, so these are primary, secondary. So in this question it is a tertiary level of prevention. Okay, what is not done in the first trimester abortion? Okay, this DNC dilatation and curettage can be done in the first trimester. If the drug regimen fail, ultimate option is DNC in the first trimester. Methotrexate, it is a toxic drug, it can be used in the ectopic pregnancy as well, or in the first trimester. Rarely used but used. Okay, misoprostol and mifepristone is the most commonly used drugs in the first trimester abortion, especially before the 7 week. Okay, if it is less than 7 week, mifepristone is very good and misoprost success rate is very good. Extra amniotic instillation of ethacardin infusion or saline infusion also, these are infusion are given in the second trimester of the pregnancy. Okay, so what is not in the first trimester, that is extra amniotic instillation of ethacardin infusion. Okay, this should be the answer. Okay, which of the now following condition hand sanitizer is not used? Okay, before the examination of patient, yes, you have to use that. Okay, after the examination of patient, you have to use that because you have to see the next patient. After touching the patient surrounding, if you are touching the patient surrounding, there might be infection, so you have to sanitize your hand, and hand after visibly soiled. Okay, after visibly soiling of the hand, sanitizer don't work effectively. You have to wash with soap and water. So although soap and water and sanitizer are equally effective, सोप एंड वाटर से हम यूजुअली कहते हैं कि 40 सेकेंड टू 60 सेकेंड हम उसको सोप एंड वाटर से हाथ को धोना चाहिए, ठीक है, एटलीस्ट 20 सेकेंड वर्ड यूज़ करते हैं फॉर द हैंड वॉशिंग. सैनिटाइज़र को भी हम लोग को 20 सेकेंड तक हाथ में लगा के छोड़ना चाहिए, ठीक है. तो इसमें हम देखेंगे कि ये विजिबल सॉइलिंग जो अगर हो चुकी है, मतलब मिट्टी लगी हुई है ना, कुछ और लगा हुआ है, कुछ पार्टिकल लगे हुए हैं, इफ़ दे आर विजिबल, सो सैनिटाइज़र यूजुअली डो नॉट effective here because it needs surface. Okay, if on the surface is something is there, so sanitizer will be spread here like this. Okay, so this can be infective. So for the visible soil thing you have to use soap and water, it is better here. Okay, irreversible method of contraception. It is a very simple question. Oral contraceptives, they are reversible. If you stop the oral contraceptive, your conception can be given. Okay, conception can be done. Implants removed, conception. IUCD removed, conception. Sterilization is a permanent method. Permanent method is a irreversible. Okay, so sterilization is vasectomy or tubectomy. Both are irreversible method of contraception. Okay, that's all about the today series of questions. Okay, you can see that the questions are very simple but catchy. Some questions are you don't find anywhere. First of all, you have to find this question in the some questions are like that only. Okay, in the AIMS or INICET, some questions are like that they come first in that question paper. Okay, then we find the answer. Most of the questions here you can find in the book. Okay, but some question you have to find from the net, because if people want that you don't solve all the questions, you have to miss some questions, that's why they have done this. Okay, so but now we know all the things what they have been asked, so this might be asked in the Neetpg as well. So these all topics are important for Neetpg as well. So all the best for the Neetpg people. Okay, so revise these topics, and these are only 19 question I think so. Okay, but in the Neetpg there will be more questions, more weightage of community medicine is there. So all the best for that, so stay tuned. That's all for today's lecture.